Kia ora, we're here today at the National Rural Health Conference, and I have with me Adrian Te Patu. Welcome, Adrian.
Thank you.
Can I call you the MC? You're the MC of this show, aren't you?
Oh, hey, you can call me anything. Look, I'm loving it. So that's one of the jobs I'm charged with doing here.
Yeah.
MCing, and I'm facilitating quite a few of the workshops as well, so it's
cool.
great.
How are you finding it all?
Oh, look, it's good. I work in public health. I work in Hawara. And so, anyway, I spend a lot of time working with a number of the people that are here.
Okay.
So I'm just really enjoying it. It's a catch-up. Yeah, I've been seeing some of the GPs that I haven't seen for like 5 years.
Yeah.
And some that I've known for nearly 20. So it's really good. I like working with in and around GPs and GP practices.
Nice. Yeah. Okay. So it's more of a social catch-up for you. In
Bit of both. So it's that whole. It's a whole. You know, as a health professional myself, a chance to see what's going on in the sector. Like I said, I'm a firm believer in GP land. And also just catching up socially with a number of people.
Yeah. Keeping them on edge, I've been seeing.
Oh, you have to, and I remind them most of them only speak one language.
Yeah, that's true. That's cool. So, Adrian, what's your background? You mentioned public health. You mentioned, can you give me a bit of an insight into your journey and where you've come from?
Yeah, sure. Look, I'm a social worker by trade, but I haven't practiced social work for many, many years. And I worked, overseas as well. I was a social worker in the East End of London as well. Right. And then decades ago I worked here with young people and gang members. I'm quite Brown-centric. I'm really interested in Māori and other Pacific people's health. And so I kind of transitioned from working in a multidisciplinary psychiatric team in Christchurch in the alcohol and drug field to moving into preventative care. So that was why I particularly moved across to public health and health promotion. Yeah, and at the moment I'm here. I was lecturing in public health for a wee while, but I kind of pollinate. I'm part of an organisation, a wee company called Manukau Associates, and we run training. We do all sorts of stuff in working with health professionals and help them do what they do even better.
Can imagine you've got a wealth of knowledge there.
Well, I have some leadership roles in public health. I'm the Vice President of the Public Health Association of New Zealand, and also represent Asia Pacific in the World Federation of Public Health Associations. It's based in Geneva. So we represent 5 million public health physicians and health promoters across the world in 100 countries.
That just sounds like a really big title to me.
That's great. It's a big, it's a lot of moving parts.
Yeah.
I'm the first Indigenous member of the Governing Council.
Nice, good work.
I think probably, and the second New Zealander on the Governing Council of this organisation. And so everything that's to do with public health is my passion. And the relationship between primary health care and public health is too important not to maintain.
Yeah, and I see from being at this conference, it's kind of the moving face, isn't it? We're sort of going from the doctor kind of role to this patient-centred care to this, sort of evolving preventative social kind of thing.
I think there's been, so one of the things that I do, because I've been running training for organisations like at Pegasus Health, and Canterbury was the largest IPA and probably collective of doctors in the country at one stage. So we've been watching the change in GP land in terms of doctors being responsive to the needs of Māori. And I think that GPs and GP practices are too important for particularly our people not to have a significant relationship with. And so our job in public health, for us to be kind of crude about it, in general about it, our job is to keep people away from hospitals and to support the significant relationship that they have with GPs and GP practices and pharmacists for that matter. Yeah. So that's a kind of a healthy, and I've seen GP practices change in the last 15 years. They've got better, more responsive. The whole thing around, it's changed for lots of reasons. Nurses have stopped becoming an oppressed culture. Practice nurses, having senior nurses in health and medicine taking on far more interesting roles. And so there's been a kind of separation of a number of things. Lead maternity care is taking some of the stuff away from GP practice in terms of maternity care. So none of that happened without a bit of a struggle and kicking and fighting away in resistance to that. And I can proudly, as an allied health professional, look across at GPs and GP practices across the nation and say, well, actually they've got so much better than they were. It doesn't mean they weren't great before, but they were kind of great for a majority of the population, not necessarily.
Yeah, there's a big history behind it all, isn't there?
Yeah,
and how we've come to what we are today.
Yeah.
And saying that, though, there's still a big fight to come ahead of us too. Yeah.
Well, yeah.
Yeah.
So what kind of fight?
I don't know, haka?
Well, interesting stuff, because there's for all gains that are made in health, there's been a struggle, and there's also a lot of those gains are easily lost without the pressure to maintain.
Totally,
those.
yeah.
So they didn't just happen.
Yeah.
And there was and they won't just stay there, and things need to be robust enough to weather political regimes or otherwise.
Yeah.
So we can stick to the hard medicine stuff, and again, as a Māori person, I'm not afraid, and I encourage our people to not be afraid of white science, and for white science not to be afraid of other things that that we can influence how best to work with our people, therefore all New Zealanders, and what contributions Māori and other Pacific folk have to make to healthcare practices.
Yeah, it's important that we acknowledge the gains that we've had, and also with acknowledging that we don't lose it, and we continue on pushing forward those issues.
Yeah. Very much so. It's an ongoing, it's not a movable feast, it's just a big ongoing hakari.
Yeah.
It's an ongoing feast, really.
Exactly.
So, which is a funny irony, because some would suggest that it's like feeding from a trough, that it's actually not as effective as it could be, but it's great. And the workshops are quite diverse, and I just came from one of the Pharmac presentations.
Oh, really? Yeah.
Great.
Yeah.
Because I'm a supporter and a defender of Pharmac, and we're the only country in the world that has an organisation like that.
Yeah, it's quite unique, isn't it?
Very unique, and it's a very brave organisation, and we do what we do. We make savings, but actually they make considered decisions, and the amount of, in their advisory groups, the amount of GP influencer, on the ground medical influence, practitioners influence is quite profound.
Yeah.
And so, in many ways it reflects New Zealand and the psyche of New Zealanders, and the generosity and hard work of Kiwis.
And it's such a needed process as well. Like we wouldn't be without Pharmac, we wouldn't have anything essentially. Yeah, we're not.
Well, yeah, we'd be paying a lot more, because we'd be paying a lot more for the drugs that we use. It probably means that we actually have less drugs in some other ways.
Yeah. They do a lot of hidden good, I would say.
Yeah, and I think ACC is a similar kind of thing. It's a great invention, and it just needed tuning, and I've seen the transition in the last decade, particularly, of an organisation like that. So all this means a significant part of the maturity of organisations and institutions and various crafts, all means that our people are getting better. And I kind of use a lot of stuff in the work that I do when I'm giving narrative to where we kind of fit. So I don't just spit numbers out about our people, but I say, the 600,000 people of Māori descent in this country in the last census, which I'm sure you all filled out 2 weeks ago. There was, the numbers probably won't change, but probably about 600,000 New Zealanders 2 weeks ago identifies as being of Māori descent, and probably nearly 300,000 fellow New Zealanders identify as being of other Pacific folk. If you took, so the median age for New Zealand at the moment is kind of in its 30s for all of us, 37. That's a half the population older, half the population younger. If all the brown folk, if all the Māori and all our Pacific cousins went to live on the Gold Coast or work in the mines of Western Australia, the median age for New Zealand would jump to 45.
That's true. Yeah.
Yeah, and so in fact that would make us probably healthier than Japanese, than the Japan, or certain pockets of people in islands off Italy or Greece. So the way we've reframed that in public health and also in primary health services is that an unfair burden of unwellness is carried by a particular proportion of the population. Now that's not a sin, it's just not right. It's not a big white conspiracy, it's kind of what it is. So we can arrest that, and it starts with a number of things. So 15, 16 years ago, the median age for Māori was probably about 20, and now it's probably about 24 maybe. Well, I'm kind of confident enough to honour GP practices in New Zealand to say I've seen the change. And I reckon good primary healthcare action and practice in New Zealand is probably responsible for one of those years, a quarter of that change. And so I'm kind of here to whakamana, to honour the practice of GPs, in this case rural GPs, who is even a more unusual situation. And to kind of see what GP practitioners and GPs look like. Yeah. Most of whom are born abroad.
Yeah, that's true. Yeah, they're a very treasured practice, I'm going to say.
yeah, very much so.
Yeah,
it's great. It's great. It's very humbling to hear a significant number of people who've been practicing in medicine in rural areas in New Zealand. They speak with such pride around the communities that they're in.
And such experience and insight as well.
Yeah, and being part of that, being fellow New Zealanders.
Yeah.
It's great. Really enjoy it.
All right. Well, Adrian, thank you so much for coming along and having a korero with us today.
You're welcome.
Very, very highly enjoyable, and I've loved watching you throughout the day and keeping me on my toes.
Oh, hey. Thank you.
Thanks.